Thank you. And as you're leaving, Uncle Tony, thank you so much for your beautiful welcome to country. Always very generous, and we always learn something new. So thank you so much. And I'd also like to acknowledge the traditional owners of the land that we're meeting on, the Wurundjeri people of the Kulin Nation, and pay my respects, my deep respects to elders past and present, and acknowledge any First Peoples who are joining us here today. And I'd also like to add my acknowledgement and welcome to people here with lived and living experience. And to Chris and to Claire and the whole team at VAADA, thank you again. It's great to be able to be back at your conference, and I know that it's an incredibly popular event, an important event to bring the sector together. And I'm in awe of all of the work that you all do each and every day. Really demanding, difficult work, but so important for our whole community. And each year this conference does bring together leaders, practitioners, researchers, and people with lived and living experience who are driving real change across our system. And the theme this year, Shaping the Future of AOD, Culture, Connection and Innovation, is very timely because together we're charting a path forward on how the AOD sector needs to evolve. Over the last few years, the Labor government has driven a harm reduction and health-led approach to alcohol and other drugs. And this has been a very deliberate choice. We've listened to communities, to people with lived experience, and to practitioners and to researchers. You've all told us that the challenges facing communities are changing. People are presenting with increasingly complex needs, drug markets are evolving rapidly, and more people are experiencing overlapping challenges across mental health, housing, family violence, the justice system, as well as alcohol and other drugs. Because of that, it's time for our responses to evolve, to ensure that together we're delivering the support and care that Victorians need. That's why we've deliberately chosen to back in a reform agenda that is grounded in evidence, early intervention, cultural safety and integrated care. It's an approach that centres individuals and meets them where they're at, whether that's looking for information, accessing life-saving interventions or seeking support to address addiction. And we're getting on with that delivery and on that delivering on that vision. Since coming to government, we've invested more than $3 billion in alcohol and drug treatment, support and services. And to deliver practical reforms that strengthen harm reduction, improve access to care and respond to emerging challenges across the system. As part of this work to improve the system over the last 10 years, we have doubled the number of residential rehabilitation and detox beds across the state, providing more places for people to access critical treatment and support across the state. The majority of these increases have been delivered in rural and regional areas, with new facilities over the last 10 years delivered in Corio, Wangaratta and Traralgon, collectively providing care and support to an additional 900 Victorians a year, and another 32-bed rehab facility on the way in Mildura. We've also delivered mental health and AOD hubs in 8 emergency departments across the state, with more in the planning. For decades, Lennox Street has been a key centre of heroin consumption and heroin harm. That's why, following 2 parliamentary inquiries, coronial findings and a grassroots campaign from the North Richmond community, in 2017 our government committed to establishing Victoria's first supervised injecting service. And we established this life-saving service where the experts told us it needed to be, where the drug harm was taking place. And because of that, it's safely managed more than 12,500 overdoses and connected thousands of vulnerable Victorians to the supports that they need to find a pathway out of addiction. And despite criticism and the loud voices and the calls for that service to close, we continue to recognise the critical importance of this work. It was our It was our Labor government that established the service, our government that made it permanent in legislation, and our government that will continue to back its work in each and every day. A key part of our work over the last 2 years has been our statewide action plan to reduce drug harms. Just a few weeks ago, we launched the first naloxone dispensing machine at the Alfred Emergency and Trauma Centre. The machine provides free 24-hour access to naloxone for people who may witness or people who may experience an opioid overdose. And it will be one of 20 naloxone dispensing machines that we trial across metropolitan and regional Victoria, building on our expansion of the take-home naloxone program and expanding access to people across our state. In recognition that our streets are often the place of last resort for those with addiction issues, we've boosted outreach street teams in the CBD, and we've established new services in Footscray and St Kilda, delivering more than 24,000 outreach contacts and making more than 5,800 connections into other support services. We've established the Burke Street Health Clinic with the Salvos, which has provided over 4,200 primary and mental health care appointments, meeting people where they're at and delivering those trusted services. And we've expanded access to pharmacotherapy through community health services, helping to bridge gaps in treatment for an additional 1,500 Victorians. And we've delivered the Victorian Pill Testing Service, which will continue under this government, backed by a $9.6 million investment in this year's budget. Since the pill testing trial commenced in December of 2024, the fixed site and the mobile services have tested more than 5,800 samples and, I think incredibly importantly, delivered more than 4,200 harm reduction conversations. It's strengthening our ability to identify in real time dangerous substances that are circulating in the community and issue very timely public warnings. And it is creating opportunities for people to engage with health professionals and receive accurate, evidence-based information in a non-judgmental setting. And later this year, we will open the Community Health Hub at 244 Flinders Street, a place where anyone can turn for treatment without judgment. The hub will have dedicated teams delivering primary care, mental health and addiction treatment, social supports and care coordination for the most vulnerable people, all under one roof. It will also host a Victorian first hydromorphone treatment trial, diverting people from the illicit drug market, giving them hope and care for those people who experience persistent addiction. This is a critical strategic health project, and I'm absolutely determined to get those doors open this year, and I'm very proud that our government has backed in this work. Of course, reforms of this scale require us to keep listening, to keep learning and adapting, and it's so important to have the right structures in place to guide our decisions with that expert advice. That's why I'm proud to announce that we have established the Alcohol and Other Drugs Ministerial Advisory Committee to help us do just that. Chaired by Dr. Paul McCartney, the committee brings together leaders from across the sector. Their role will be to strengthen transparency and accountability and to build confidence in Victoria's approach to reducing AOD-related harms. Importantly, the committee will help drive innovation and support delivery of key reforms, including the implementation of our Victorian AOD strategy, the 10-year strategy that we released late last year. Their work is already underway, and I'm really looking forward to what I know will be their frank and fearless advice. All this work requires ongoing investment and partnership with you, the sector. And this year's state budget continues that significant investment in alcohol and other drug reform and harm reduction initiatives. The budget invests $94.3 million to continue critical AOD services, programs and supports across Victoria, and that includes the continuation of the Aboriginal Metropolitan ICE Partnership Program, measures to address pharmacotherapy service gaps, provision of take-home naloxone, continuing services at the Melbourne Drug Court, and for first step to provide integrated mental health and addiction support services. The investment also includes $52.3 million over 2 years to strengthen our health-led response to the decriminalisation of public intoxication. And it includes funding to continue the outreach and sobering service response in metropolitan Melbourne, as well as for First Nations-led outreach and places of safety in both Melbourne and regional Victoria. And importantly, the budget will fund an Aboriginal-led co-design process that will help shape the next phase of public intox reform. This will ensure future service delivery continues to be guided by Aboriginal leadership, cultural safety and operational learnings from the first 2 years of implementing our health-led approach to decriminalising public intoxication. The budget also includes funding to continue to implement the Victorian AOD strategy, including those foundational system redesign works that an Aboriginal self-determined pharmacotherapy pilot and a low-dose methadone trial. So a number of really important programs that have been funded in this year's budget. Together, these investments reflect a clear commitment to building a more connected, responsive and contemporary AOD system. And I know that there's a lot more that we need to do. Our work over the last 10 years has delivered some big reforms and built the foundations of our harm reduction approach. But our work over the next few years must focus on the system that we collectively need. Our government's vision is to take the programs and key initiatives already underway and work with all of you to integrate these into a statewide AOD system that is easier to access, more equitable and more effective. We know demand for AOD services is increasing and the pathways to treatment can be complex and inflexible. And there's much more work to be done to reform our treatment systems to ensure that they are providing new treatment options, that they're responsive to complexity and to the increased volatility that we're seeing in the community. That's why work is already underway to reform intake modelling and to reduce those intake barriers, helping people get in the front door to treatment quicker and more easily. And the first stages of the implementation of the AOD strategy will include work to strengthen the treatment system and promote a person-centred model of care where intake, assessment and care planning are better aligned. Of course, this work won't be quick and it will be challenging, but what we're talking about is an opportunity to reconsider and redesign what it looks like to deliver high-quality, person-centred and integrated care in this state. What we're asking is, what does a future AOD system in Victoria need to look like? Of course, there are some people in this state who would prefer to take us backwards, who would close the medically supervised injecting room, who would ban pill testing, like we've seen in Queensland, and seek to remove important harm reduction measures like the NSP program for our local communities. People who would bring shame and stigma back into the conversation about addiction. So what I'm saying is that the progress that we've made, the innovative services that we've delivered and the health-led approach that we've pursued, they are all on the ballot in November. AOD policy is a clear point of difference between the Labor approach and those in the opposition. Our Labor government is up for that debate. We're up for defending our approach and prosecuting the case for what our AOD system needs to deliver into the future. We're up to meeting emerging drug and alcohol trends with new solutions and new services. We're up for delivering service redesign that supports good outcomes for Victorians and is sustainable into the future. And our government is up for making harm reduction business as usual in this state, so that when you need help, you are met with compassion, not judgment. We've mapped out this in the Victorian AOD strategy, and we are determined to continue this work with all of you. I do want to thank you, each of you, for the work that you do every day. It's really challenging work, but you are helping people, Victorians, families and communities every single day. I look forward to working with you to shape the future of an AOD care system in this state that we can all be proud of. There's a lot on the line, so let's keep working together. Thank you.